The hardest part about health after 75 is that serious symptoms often don't feel serious. In the beginning, many of them develop slowly over time, becoming part of everyday life. Before older adults realize something may actually be wrong. 1. Feeling weak during simple daily activities. One symptom many older adults overlook after 75 is gradual physical weakness. Not sudden collapse, not severe pain. Just everyday movements, slowly becoming harder than they used to be. Standing up from a chair may take more effort. Carrying groceries may suddenly feel exhausting. Walking short distances may leave the legs feeling unusually heavy. Because these changes happen little by little. Many people never notice how much strength they've actually lost. But doctors say declining strength after 75 deserves attention, especially when weakness begins interfering with normal, daily activities in some cases. It may be related to muscle loss that naturally increases with age. But weakness can also be linked to poor nutrition, lack of physical activity, dehydration, medication effects, circulation problems, infections, or underlying medical conditions. And once strength declines too far, recovery becomes much more difficult. Simple tasks that once felt automatic can slowly affect independence, balance, and mobility. That's why doctors encourage older adults not to ignore unusual weakness even when it develops gradually over time. 2. Shortness of breath during normal activities. Many people expect breathing problems during heavy exercise, but after 75, becoming breathless during simple daily activities may deserve medical attention. Some older adults notice they suddenly need to rest more often while walking. Others become winded while getting dressed, talking for long periods, or climbing a few steps. Because these symptoms often appear gradually, many people simply slow down without asking why. But doctors say shortness of breath can sometimes be linked to heart disease, lung conditions, anemia, poor circulation, infections, or reduced physical conditioning. And the longer physical activity is avoided, the weaker the body may become over time. Breathing changes become especially concerning when they appear alongside chest discomfort, swelling in the legs, dizziness, or unusual fatigue. That's why persistent breathing difficulties should never be dismissed as a normal part of aging. 3. Changes in memory that affect daily life. Forgetting a name occasionally can happen at any age. But doctors become more concerned when memory problems begin interfering with normal routines. For example, forgetting medications, repeatedly getting confused in familiar places, repeating the same questions often, or struggling to follow conversations. Many families assume these symptoms automatically mean dementia, but memory changes can also be connected to poor sleep, depression, hearing loss, medication side effects, dehydration, vitamin deficiencies, or infections. The important thing is noticing when forgetfulness becomes more frequent or starts affecting safety and independence. Because in some cases, identifying the cause early may help slow progression or improve treatment options. 4. Swelling in the feet or legs. Many older adults notice swelling around the ankles and assume it's harmless. Sometimes it may simply happen after sitting too long. But persistent swelling can also be linked to circulation problems, vein disorders, kidney disease, heart failure, or medication side effects. Doctors become especially concerned when swelling appears, suddenly becomes painful, or happens alongside breathing problems and fatigue. What makes this symptom easy to overlook is that it often develops slowly. Over time, shoes may feel tighter, sock marks may become deeper, walking may begin feeling more uncomfortable. And because the changes happen gradually, many people adapt without realizing the symptom may be worsening. That's why ongoing swelling should never be ignored after 75. 5. Unexplained weight loss. Losing weight without trying may sound harmless, but after 75, unexpected weight loss can become a serious medical concern. Doctors pay close attention when someone begins losing weight without major changes in diet or physical activity. Possible causes may include digestive disorders, difficulty chewing, depression, medication problems, infections, diabetes, thyroid conditions, or other illnesses. In some cases, older adults simply stop eating enough because preparing meals becomes tiring, or food no longer tastes the same. Over time, muscle mass decreases, energy levels drop, and weakness becomes more noticeable. Unfortunately, once severe muscle loss develops, rebuilding strength becomes much harder at older ages. That's why doctors recommend paying attention to sudden or ongoing weight changes. After 75-6, losing balance more often. One of the most overlooked symptoms after 75 is subtle changes in balance. At first it may not seem serious. Needing to hold on to furniture while walking, feeling unsteady when turning around, walking slower than usual, or becoming more nervous on stairs, because these changes often happen gradually. Many older adults assume it's simply part of aging. But doctors say balance problems can sometimes be connected to muscle weakness, inner ear problems, reduced vision, nerve damage, medication side effects, poor circulation, or certain neurological conditions. And after 75, even a small balance issue can become dangerous very quickly. Falls are one of the leading causes of serious injury. In older adults, a single fall may lead to fractures, hospitalization, loss of mobility, or long recovery periods that become harder with age. What makes balance changes especially concerning is that many people begin adjusting their lives around the symptom without realizing it. They walk less, avoid going outside, stop using stairs, or move more carefully every month. Over time, the body becomes weaker, which can increase fall risk even more. That's why doctors recommend paying attention to balance changes early, especially when they begin affecting confidence, walking speed, or daily movement. 7 sudden changes in sleep. Sleeping far more than usual, or barely sleeping at all, may sometimes signal underlying health issues, pain medication side effects, anxiety, breathing disorders, or neurological conditions can all affect sleep patterns in older adults, especially when sleep changes begin affecting mood, memory, or daytime energy. 8. Hearing loss that slowly gets worse. Hearing changes often happen so gradually. Many older adults don't notice how much hearing they've lost. Over time, conversations become harder to follow, especially in noisy places. Doctors say untreated hearing loss may increase isolation, confusion, and cognitive decline in some older adults. 9. Bruising more easily. Aging naturally makes the skin thinner and more fragile, but frequent, unexplained bruising may also relate to medications, fragile blood vessels, or certain medical conditions, especially when bruises appear often or without clear injury. 10. Ongoing digestive problems. Many older adults ignore digestive changes because they seem minor at first: constipation, bloating, stomach discomfort, or changes in appetite. But doctors say persistent digestive symptoms should never be ignored. After 75, long-term digestive problems may sometimes be linked to dehydration, low fiber intake, medication, side effects, infections, food intolerance, or more serious gastrointestinal conditions. Even chronic constipation can increase discomfort, weakness, and fall risk in older adults. That's why medical experts recommend paying attention when digestive symptoms continue for weeks, especially if they worsen over time. 11. Feeling cold more often than before. Many older adults notice increased sensitivity to cold temperatures. As they age, part of this happens naturally because circulation and body composition change over time, but doctors say constantly feeling cold may also be linked to anemia, poor circulation, thyroid disorders, nutritional deficiencies, or low body weight, especially when cold sensitivity appears suddenly or alongside fatigue and weakness. Sometimes the body is signaling that circulation or metabolism is not functioning properly. After 75, paying attention to small symptoms can make a bigger difference than many people realize, because sometimes the body whispers long before it starts screaming.